So this had been a planned trip for quite some time. There's an option to do a tropical medicine elective through the hospital, and a group of 6 residents were signed up and ready to go on Wednesday morning, the morning after the earthquake, so of course all our flights were canceled. It was a huge scramble.
Our plans changed so many times within the first 72 hours. You know, initially we weren't going and thought, well, we have to repack, we have to take out the vitamins and take out the Tums and pack things for wound dresses and pack more IVs and things like that, but we're definitely still going to go. That was my first thought.
We arrived, and understanding that one of the very, very important parts of this is just having the right people there and having a logical flow to things. We had tons of supplies, but at first we didn't have a good way to find them.
I knew right away that, sure, I am a doctor and I'm trained to be a doctor, but I'm here to do whatever. You know, whatever you need, I'll do it. I didn't have that much time to let too much go through my mind, because already, right away, people were grabbing me, you know, pointing to their IVs that had run out, pointing to, you know, blood that had infiltrated, pointing me to, you know, their legs, saying like, oh, I'm in pain, what can you do? So it didn't take that long for me to just kind of throw down my stuff, grab what I needed, and just to kind of start. Probably the first thing that really struck me was the smell. And there was just so many infections and so much dead tissue and a lot of gangrene. I hadn't seen that many open fractures before, where the bone's actually sticking out, and we saw a lot of that. Just kind of basic pathology that we hadn't seen. And at one point we had a kid who had just typhoid fever, and I'd never seen typhoid fever before. And so not only were we dealing with kind of general, you know, wound, disaster medicine, but we were also doing the tropical medicine that we'd set out to do.
It was overwhelming. You start one patient at a time, and as you start taking care of patients, you start to forget how overwhelming it is. But first looking out at all those people and all those injuries, and you know, thinking, can I do this? But we did. I'd see the news like everyone else. I saw the pictures, but I think that until you're seeing it in person, I think that it's difficult to really wrap your hands around. I think in particular, getting to know individuals is one of the hardest parts, because when you see it on TV, it's people, it's a massive group of people who are injured and hurt. When you're there, it is a person that you are taking care of, that you are trying to help sitting in front of you.
I mean, there's something always very special about caring for children, and why I went into pediatrics. Kind of no matter what the adversity they're facing, they're still kids. And you know, and I think our 3rd or 4th day there, somebody found some coloring books, and to see them playing with coloring books and just having a good time. I mean, it was really neat to see. We had one section we called our little girl section, because there were a couple of young orphans who were probably between the ages of 6 and 12, and because the cots were very fluid, we kind of just got them all into one corner together. And one young girl who hadn't said a word since she'd been in the hospital and was an orphan, and I don't think we even knew her name because she hadn't spoken. You know, there she was playing with these other little girls, because we'd finally found like a cohort for her to play with. I mean, it was really sweet to see them draw her out.
Lovely, lovely little boy, Jean Wesley, his nickname's Bouchon, wants to come visit me. Gave him my phone number, my email. I pray that he'll reach me one day. And saying goodbye to him, and we both cried, and it was, I think, probably one of the most difficult moments for me, was just saying goodbye to him, and him knowing that I was leaving him there.
I definitely had some points where emotionally I sort of broke down. That was usually after becoming close to a patient, and then you know, going through a traumatic experience with them. But I think just there was something else that had to be done. You know, there was a next patient to see, there was another wound to clean, and I had to just keep working. And so I just kept working. I knew that there was so much more work to be done, so I did it. There are a number of things that are going to stick with me. I think that the feeling of helplessness while I was there is something that I'm not used to experiencing. Kind of no matter what the situation you're in here, there's always something that can be done about it, or at least something that can be tried. But to be down there where your hands are tied, where you can't do anything other than, you know, try an IV antibiotic and try to give pain medication.
I think that Haiti for me will always be a really important time in my life. I mean, it was 4 or 5 days, And I felt like I was gone for months. I felt like I made connections with people that I had known for months.
It was a very difficult, challenging, horrible, but rewarding and enriching experience as well.